Usually, when we picture a crisis in our education system, we imagine something tangible. Yeah, something you can actually point at.
Right, like 35 kids crammed into a classroom built for 20?
Exactly. Or like a leaky gym roof, or a stack of textbooks held together with duct tape.
Yeah, physical problems.
Right, physical problems. You can walk into a building, point a camera at them, and just say to the school board, look, there is the problem. But today, we're taking a deep dive into a crisis that is completely invisible to the naked eye.
It really is. It doesn't show up on a building inspection at all.
No, it doesn't. Yet it's arguably the single most staggering structural issue facing our schools right now. We're talking about what's called the 48% gap.
Which is just a terrifying metric when you realize what it means.
It really is. And just to be clear about what that number actually represents for you listening, the source material we're looking at today defines this gap very specifically. It means 48% of students who are actively identified as needing clinical mental health intervention receive absolutely zero care.
Zero. I mean, almost half the kids who desperately need a lifeline are simply slipping through the cracks.
It's a massive void right in the center of the educational system.
And because it happens so quietly,
Mm-hmm.
a student slipping into depression at home or dealing with unmanaged anxiety in the back row of a math class, it remains largely invisible until you aggregate the raw data, that is.
Right. And once you see that 48% figure on paper, it honestly becomes the only thing you can focus on. It forces a complete reevaluation of how a school is even supposed to function.
To understand the anatomy of this gap and, well, how educational leaders are desperately trying to build a bridge over it, we have a really fascinating stack of source material today.
We do. We're looking at a highly targeted, incredibly candid briefing. This document was not written for public relations, right? And it certainly wasn't written for a general audience.
No, definitely not. It was put together specifically for school superintendents, principals, and district counseling directors down in Georgia.
Yeah, and it basically outlines the mechanics of a K-12 mental health support program called MentalSpace School.
What's really fascinating here is how the source material completely avoids the typical corporate marketing fluff. I mean, when you're writing for superintendents and district financial officers, you really can't just pitch a feel-good product.
Right, because these are the people balancing multi-million-dollar budgets.
Exactly. They're the ones answering to angry school boards every Tuesday night. They need to know the operational reality. So this briefing actually takes the time to dissect the systemic failure of our current education infrastructure.
It reads way less like a sales pitch and much more like an autopsy.
An autopsy of why the traditional mental health support model in public schools is just completely collapsing under the current weight.
Okay, let's unpack this, because before we even get to mental space school as a potential solution, we have to look at the autopsy itself.
Right, we need to figure out where this massive 48% gap actually comes from.
Yeah, like why are schools, which, have always dealt with student behavioral issues, why are they suddenly struggling so profoundly to manage this?
Well, the briefing documents isolate the root of this collapse into four intersecting drivers. And the first one is entirely economic. It has to do with the end of ESSER funding.
Ah, right. That was the massive federal pandemic-era relief package, right? Like the money the government pumped into schools to keep them afloat during COVID?
Precisely. For the past few years, school districts all across the country had access to these temporary federal emergency funds.
Right.
And because the mental health fallout from the pandemic was just so severe, districts used a massive chunk of that ESSER money as a financial safety net.
So they used it to temporarily hire extra counselors and bring in part-time therapists.
Yeah, exactly. Basically to patch the gaping holes in their mental health services.
Yeah.
But that federal funding came with an expiration date. And for most districts, we've hit the cliff.
The money has just dried up.
Overnight, schools are staring down a massive financial void. The artificial safety net has been pulled away, but, and this is the tragic part, the students who are relying on that net are still standing there, needing the exact same level of care.
Man, which just sets off a brutal chain reaction, right? Leading directly to the second driver the source highlights, which is the personnel shortage.
Yes, but the briefing makes a very specific distinction here. This isn't just a vague national talking point about a labor shortage.
Right. The documents emphasize that these are severe, localized shortages. We're talking about qualified counselors, social workers, and school psychologists.
The geographical reality is the real bottleneck. A superintendent might actually be able to scrape together the budget to hire a new clinical psychologist for their high school, but when they post the job listing, absolutely no one applies.
Oh, wow.
Yeah. The professionals simply do not exist in the numbers required within those local zip codes. The talent pool is just incredibly shallow.
And public schools are often competing with private practice salaries that they simply cannot match, right?
Exactly. They can't even come close.
So, you have a superintendent with an evaporating budget trying to hire from an empty labor pool. And then we introduce the third driver, which is the sheer volume of demand.
Right. The demand for mental health support inside the building isn't just holding steady, it's aggressively expanding.
And the source points out that this is actually sort of a double-edged sword. Like, we are getting much better at identifying student needs. Teachers are, trained to spot the signs of anxiety, trauma, and depression.
Which is a good thing. Early identification is crucial.
It is, but the consequence is that the line of students sitting outside the school counselor's door just keeps getting longer and longer.
It creates a fundamentally impossible math problem. You have decreased state and federal funding on one side of the equation. You have a static or actively shrinking pool of local mental health professionals on the other.
Yeah.
And right in the middle, you have this rapidly expanding population of students requiring acute clinical intervention.
Which culminates in the fourth driver, right? Where the briefing gets brutally honest about the hiring market itself.
It states point blank that regional hiring markets simply cannot scale fast enough to close this gap with internal headcount alone.
Right. It's functionally impossible for a school district to just, hire their way out of this crisis.
It is a totally sobering reality check for any district administrator reading this.
Man.
If your only strategic plan to support your students relies on hiring more internal full-time staff, the underlying economic data guarantees that you're going to fail.
Because the infrastructure of the labor market just cannot support that strategy.
Exactly.
It's like a town facing a rising flood, but their emergency budget just ran out, and there literally aren't enough contractors in the state to build the dam anyway.
That's a great way to put it.
They're just standing there watching the water rise, knowing that their traditional methods of sandbagging are completely insufficient.
If we connect this to the bigger picture, it completely reframes how we should view our local school administrators in the context of this mental health crisis.
How so?
Well, as an outsider, it's very easy to look at a local high school that is failing to provide adequate therapy and just assume it's a failure of leadership, or a lack of caring, or poor prioritization.
Sure, yeah.
But this autopsy shows us that it's actually a structural impossibility. The schools aren't failing to care. They're failing to overcome the laws of supply, demand, and dried-up pandemic resources.
And that impossible structural dead end is the exact environment where an external clinical partnership transitions from being like a luxury to an absolute operational necessity.
Because if you can't build the dam internally, you have to bring in outside infrastructure.
Exactly. And that reality bridges us directly into the solution proposed in the briefing, which is MentalSpace School.
The framing in the source material is crucial here, by the way. MentalSpace does not present itself as a total replacement for the school's internal counseling system.
Right. Instead, it defines itself as an infrastructure plugin.
Yes. It's a pre-built, external clinical framework designed to attach directly to a school's existing day-to-day operations.
I really want to dig into the mechanics of what this plugin actually looks like in practice, because the list of integrated services is intense. The foundational piece they highlight is same-day teletherapy access for students who get flagged by the school.
That's a massive deal.
We really need to pause on that. Same-day access. I mean, if you have ever tried to find a therapist for a teenager in the private market, you know that wait lists can stretch for 3, 4, or even 6 months.
Easily.
Offering same-day access intercepts a crisis in real time, rather than putting a struggling kid on a 6-month holding pattern.
And the mechanism behind that same-day access is what actually makes it viable.
Yeah.
It's not just some decentralized random call center where a student gets a different operator every time they log in.
Right.
The documentation specifies that MentalSpace assigns dedicated therapist teams to each specific school.
That structural choice is critical.
It really is. It means the remote therapists actually learn the specific culture, the demographic challenges, and the context of the school they're supporting. They essentially become an extended part of the faculty, even though they're delivering the clinical therapy remotely.
And they also cover a wide spectrum of care. Like, we aren't just talking about light academic anxiety here.
Not at all.
The source details comprehensive crisis intervention, suicide and violence prevention protocols, family counseling, and crucially, staff wellness programs.
That last point feels like a massive acknowledgement of the collateral damage of this crisis.
Seriously. They're treating the entire ecosystem of the school, including the educators who are completely burning out trying to manage that 48% gap on their own.
Because student mental health cannot be treated in a vacuum. A student's well-being is intrinsically tied to the stability of their family at home and the psychological health of the teachers leading their classrooms.
Yeah, absolutely.
And to effectively engage with that complex ecosystem, the briefing emphasizes that MentalSpace deploys licensed, diverse, and culturally competent therapists.
Which is an absolute necessity for engagement. I mean, if a student sits down in front of a screen for a teletherapy session and feels fundamentally misunderstood by the person on the other end, they're just going to shut the laptop.
Exactly. Cultural competency is the mechanism that bridges that initial trust gap.
Now, beyond the clinical care, the briefing outlines how MentalSpace solves a massive hidden administrative nightmare for these school districts. Because the collision of educational law and medical law is just a minefield.
It really is. Let's break that down because the briefing throws around FERPA and HIPAA compliance a lot.
Yeah, for anyone who isn't a lawyer or a school administrator, why does a school care about that when setting up a therapy program?
It all comes down to data privacy boundaries. FERPA is the federal law that protects a student's educational records, grades, disciplinary history, things the school manages. IPA is the federal law that strictly protects an individual's private medical and mental health records.
Right.
If a school tries to build its own internal clinical therapy program, they suddenly have to figure out how to build an airtight firewall between the principal's office and the therapist's notes. It is a legal labyrinth.
But MentalSpace brings a ready-made, separate infrastructure that is inherently HIPAA and FERPA compliant.
Precisely. The school doesn't have to build that secure, highly regulated medical environment from scratch. They just plug into the one MentalSpace provides.
And the briefing notes a very specific ticking clock for these Georgia school districts regarding compliance. It mentions the upcoming HB 268 deadline in July 2026.
Right, that's a looming state mandate. It requires schools to meet specific benchmarks for student safety and mental health support.
And MentalSpace explicitly positions its infrastructure as an out-of-the-box solution to help districts achieve compliance before the state comes knocking.
For a superintendent reading this document, that detail moved the proposal from the interesting ideas pile straight to the urgent action pile. I mean, they're staring down a state mandate, and here's a partnership offering to absorb the entire regulatory headache.
Okay, wait, I have to jump in here with some pushback.
Sure.
As I was reading through the mechanics of this, the same-day teletherapy, the dedicated clinical teams, the airtight legal compliance, I couldn't shake one massive logistical question.
What's that?
How on earth does a busy, overwhelmed parent actually navigate the logistics of this? Think about it. The school initiates a clinical teletherapy service for a kid. Does the school then send a medical bill to the parent?
Oh, right.
Like, does a working mother suddenly have to spend 3 hours on the phone with her insurance company figuring out-of-network telehealth deductibles just because the school counselor clicked a button?
That kind of financial friction would absolutely prevent families from utilizing the care.
Exactly. It's usually a deal breaker.
It is the most critical vulnerability of any school-based health initiative. And the briefing addresses it by explaining exactly how their financial mechanics work. MentalSpace structurally removes the school district from the financial transaction entirely.
Okay.
The school identifies the need, but MentalSpace handles the insurance billing directly with the families on the back end.
Even so, I mean, dealing with insurance is notoriously painful. Parents might just opt out to avoid the headache altogether.
They mitigate that by securing in-network status with the major carriers. The document lists all the heavy hitters. You've got Blue Cross Blue Shield, Cigna, Aetna, United Healthcare, along with several regional providers like Humana, Peach State, CareSource, and Amerigroup.
Wow, that's a lot.
By operating in-network, they dramatically slash the out-of-pocket costs and basically eliminate the need for parents to file complex reimbursement claims. They remove the administrative burden from the family.
But wait, what happens to the families who don't have access to private premium health insurance? Because statistically, those are the students who are often the most vulnerable to falling into that 48% gap in the first place.
The briefing provides a very direct answer to that. And honestly, it might be the most consequential detail in the entire document. For Medicaid patients, the out-of-pocket cost is exactly $0.
Really? Zero?
$0. By entirely absorbing that cost for Medicaid families, and handling the complex in-network billing directly for everyone else, MentalSpace transforms this from a theoretical service into a practically accessible one. They remove the economic barrier right at the point of care.
Man, that drastically changes the viability of the program. So we have this sophisticated external infrastructure. It handles the legal red tape, navigates the insurance maze, provides same-day clinical access, and removes the financial barrier for the most vulnerable kids. Looking at all of that, a district financial officer could easily look at this briefing and say, fantastic, we have our solution. We can permanently freeze the hiring budget for our internal school counselors because this tech platform is going to handle everything.
But that is a really dangerous assumption. And the source material dedicates a significant amount of text to forcefully pushing back against that exact idea.
It really does. The briefing is hyper-focused on establishing the strict boundaries of this partnership.
It outlines exactly what a clinical plugin does not replace.
Right. The document is incredibly clear that this partnership does not replace the physical school counselors. The internal staff remains what they call the relational frontline.
Yes, the relational frontline. They are the trusted, physical adults walking the hallways, standing in the cafeteria, and interacting with these kids every single day.
Because a remote teletherapist, regardless of their clinical expertise, is ultimately trapped behind a screen.
Exactly. They cannot read the room. They're not going to notice a student whose hygiene has suddenly deteriorated over a 2-week period. They aren't going to see a kid sitting completely isolated during a pep rally.
That ambient physical observation requires a human being in the building. That relational front line is completely irreplaceable.
The briefing also makes it clear that MentalSpace does not replace the judgment of the school's administration. The local leadership team retains full authority to determine which students actually require a clinical referral.
So the external platform doesn't come in and just hijack the school's internal triage process.
Exactly. And, most importantly, an external vendor cannot replace the inherent trust that a school has cultivated within its specific community. MentalSpace relies entirely on the school's established credibility.
Oh, that makes sense. Like when a parent gets a call suggesting therapy, they are far more likely to agree if the recommendation comes from the vice principal they've known for 5 years.
Like, rather than some automated email from an outside health tech company.
Here's where it gets really interesting to me. The briefing describes the ideal execution of this entire system, and it hinges on deep, continuous collaboration. They call the healthiest version of this model layered.
The layer approach.
Yeah. And the best way to visualize this layered approach is to think about how a modern hospital operates. Like the in-school counselor is essentially the triage nurse and the trusted primary care doc all rolled into one.
Right.
They know the patient's history, they spot the initial symptoms in the hallway, and they provide the foundational day-to-day relational care. But the moment they realize a student is facing an acute crisis, severe trauma, deep depression, suicidal ideation that is beyond their scope, MentalSpace becomes the specialist. They're the targeted clinical surgeon called in for the intensive treatment.
But the layers have to communicate. The school's internal team identifies the escalating need, the MentalSpace clinical team steps in to treat the acute issue, and critically, both teams maintain a continuous loop of communication.
So the student isn't just dropped once the teletherapy session ends.
Exactly. And according to the source material, when a school district actually implements this layered model correctly, the outcomes are staggering. The briefing cites an 89% improved attendance rate among the students utilizing the program.
Wow, 89%.
We really have to look at the mechanism behind that specific number, because attendance isn't just about truancy here. Severe, untreated anxiety often physically manifests as school refusal.
Right.
A student's nervous system is so overloaded that they simply cannot walk through the front doors of the building. When you introduce targeted, same-day clinical therapy, you give that student the coping mechanisms to regulate their nervous system.
You treat the root cause of the school refusal.
Yes, and as a direct result, they end up back in their desk.
Which, beyond the obvious benefit to the child, directly impacts the district's funding, which is often tied to daily attendance metrics.
Very true.
The briefing also reports a 92% reduction in anxiety among participants and an 85% overall family satisfaction rate. Those metrics represent a fundamental stabilization of a student population that was previously in crisis.
The tone of this specific section of the briefing is highly strategic, actually. By Being aggressively honest about what their platform cannot do, MentalSpace gives the superintendent the exact rhetorical armor they need before walking into a skeptical board meeting.
Oh, that's smart.
If an administrator stands up and overpromises, like if they claim a new teletherapy partnership is going to magically solve every emotional deficit and replace the beloved, overworked school counselor, the community will immediately reject it.
Yeah, they would absolutely be accused of trying to automate away human connection.
Precisely. By clearly defining the boundaries and championing the internal staff as the irreplaceable relational frontline, this briefing protects the community's trust. It elevates the role of the existing counselor while simultaneously outsourcing the heavy clinical capacity that the district's budget simply cannot sustain.
So, what does this deep dive mean for you? Whether you're listening to this on your commute, at your desk, or while making dinner, it means that the 48% gap isn't just a grim piece of trivia.
No, it's a harsh structural reality.
It's forcing a massive, real-time evolution in how society cares for its youth. Whether you are an educator exhausted by the weight of your student's trauma, a parent actively worried about your child's access to care, or simply a taxpayer wondering how your local district is managing its resources in this post-ESSER era, this shift directly impacts your community.
It really does.
The inevitable move away from impossible internal hiring goals toward these layered clinical partnerships like MentalSpace School represents the absolute new frontier of K-12 education.
It forces an acknowledgement that we can no longer expect our local schools to function as fully self-contained psychiatric facilities.
Yeah.
They simply do not have the architecture or the economy for it. They must integrate with external clinical infrastructure if they're going to survive the rising tide of student need.
Well said. And if you happen to be a school leader listening to this, or if you're a highly involved parent who wants to examine the granular mechanics of this plug-in model for your own local district, the source material provided two direct avenues for contact.
Right.
You can view the comprehensive program details at mentalspaceschool.com, or you can reach out to their specialized team directly via email at mentalspaceschool@shekritherapy.com.
This raises an important question for all of us to consider as we watch this new frontier rapidly develop in our own neighborhoods.
What's that?
If this layered model is truly the only viable path forward, if it becomes the absolute national standard and public schools permanently establish themselves as the primary gateway for clinical, in-network mental health care for children, how does that fundamentally change our society's underlying definition of what a school is actually supposed to be?
Man, that is a fascinating, heavy thought to end on. The brick-and-mortar building might look exactly the same from the street, but the function of what is happening inside those walls is shifting dramatically beneath our feet. Thank you so much for taking this deep dive with us today. The next time you drive past a local high school, remember, the biggest challenges they are fighting right now aren't always the visible ones. Sometimes it's that invisible 48% gap and the quiet, layered, collaborative work happening behind the scenes to finally build a bridge across it.